Okay, it is November 17th. And it is 1 p.m. and this is the Flathead City County Board of Health meeting. I'd like to start out with attendance, please.
Artis, here. Dawn,
Here.
Jessica, here. Pam,
Here.
Pete, Rod,
Present.
Roger, and Ronald.
Ronelli's here.
So Roger couldn't make it today. I believe Pete's going to be a little bit late, but should be showing up, I believe. So with that, we'll go to approval of the agenda. Anyone have any questions or have a chance to entertain a motion?
Make a motion to approve the agenda. Second.
Any discussion? All in favor?
Aye.
Opposed, same sign. Okay. Citizen comments. Did we have any? I didn't see any written comments. Did we receive any? Okay. So verbal comments. First of all, do we have any online?
No.
Okay. So we'll go to in person. This is time for citizen comments. Anyone wishing to speak to the Board of Health, please step forward. Give your name, address, and your comments. Good morning.
Good morning. Good afternoon. My name is Jennifer Tipton. I live at 123 Crabtree Lane, South Kalispell. Our property is adjacent to 305 Wiley Dyke, which is the property that has just been approved for sale for the new sewage treatment plant. And while I understand that there is a need in this valley, we're growing and growing very, very fast. And I definitely understand the need for a new septic facility. I believe that it should go somewhere that isn't surrounded by residential homes and agriculture. It's right next to Wiley Slough, which is part of the chain of sloughs that is a migratory bird habitat. And we see all kinds of wildlife there. I feel that this would be very disruptive to our way of life out there. My father bought that property in 1982. It was an open field when we moved out there. And we have since planted over 100 trees. We garden, we raise chickens. My whole family, there's about 8 of us, 8 households that live out there. My father split a portion of his property and gifted each of his children a portion. We all live out there, raise our families. And I just can't believe that this is possibly happening in my backyard. My brother's well is 50 feet from this property, and I have a lot of concerns. If something were to fail in that system, all of our drinking water would be contaminated. And I sincerely ask that you consider somewhere more industrial for an industrial project like that. Thank you.
Thank you. Like that's it. So thanks for coming in today and sharing your concerns. We go on to our next item, which is approved minutes from October 20th, 2022 meeting. Did everyone get a chance to look at that? Entertain motion?
I'll make a entertain motion to approve the minute October 20th minutes.
I second.
Any discussion? And none, all in favor?
Aye.
Aye.
Opposed, same sign, motion carries. So before we get into the department's reports, I understand we have some students here, some nursing students. And I'd like to give an opportunity for each of them to come up to the podium and give us your name and why you're in the nursing field, I guess, or what's your goal is.
Hello, my name is Logan Robinson, and I plan on being a post-critical care unit nurse. Yeah, just trying to keep it
Awesome.
short.
Well, thank you for coming up.
Thank you, thank you.
All right.
Karen Ford, I want to start in the emergency department and work with our public health rotation. So that's why we're here.
I'm working with one of the ERs.
Hi, my name's Priya Foreman, and I also want to work in the emergency department.
My name is Matt Bowman, and I want to be an ICU.
Well, that's great. Welcome. All right, we're ready to department reports. First one's community health.
Afternoon, everyone. I am also going to be very brief and short today. Couple of things that we've been doing last month and this month in immunizations, is we did finally get around to doing our lead testing with our Head Starts in Kalispell and Columbia Falls. We were able to test about 150 kiddos, which was great because we haven't been able to do that in probably, 2 years? Definitely at least 2 years, I think. One of you helped us, right? Got to share that experience with the students. And then we have been doing, besides our huge community flu clinic that you guys all know we did in October, we have been trying to do smaller community flu clinics. So we did one in Big Fork, and today most of our nursing team is out in Sioux Falls and Hungry Horse doing a clinic, which I thought I saw Jill's name pop up on there. And Jill is one of those people out there today. Other program updates, WIC was also busy with some students or MSU dietetic interns. We've had 2 come through October and November, and they've been doing some outreach initiatives with us. The state WIC department's really focusing on recruitment and retention and improving shopping experiences for our WIC participants. So we've had our interns helping out with stuff along those lines, making some shopping lists for some of our most utilized WIC stores. And then for our recruitment portion, we actually started a partnership with North Valley Food Bank. So I think we're going there tomorrow to do some participant recruitment, and that will be a monthly thing for us now. My visiting has been busy planning our holiday group connections for our families. We're going to be doing a really fun Santa's workshop with Santa photos and ornaments and cookie decorating, fun stuff. And then we've been organizing our family's wish list, because the Northwest Montana Association of Realtors is helping out with gifts again this year for 24 of our families. That actually does take a lot of organizing and effort from our home visitors, so they've been working really hard with that. Asthma, Rebecca's still rocking it in asthma, 100% caseload. She's actually above that and continues to get a lot of referrals coming in. And MCH wrapped up last year's fiscal year, end of September, and started our new fiscal year. Same project of Safe Sleep. And I think we tallied up about a little over 500 resource packets that we gave out to the community for Safe Sleep initiative last fiscal year. You guys have any questions?
So the lead poisoning is you actually have reported in communicable disease,
Lisa?
right?
Yes.
Yeah. So what's
I
that?
just reported the general number. She'll talk about any elevated.
Yeah. Okay. So you want me to say? I guess I just had a question, since you said that you had brought it up in your report. Want me to say my lead poisoning question? For
If it's about specific elevated results or anything like that, like nursing oriented, yes.
Okay, I'll say that.
Please, thank you. I would have, if one of my nurses was available to give that
Oh, yeah.
presentation, you could have hammered them.
We'll be fine.
Anything
All right,
else, guys?
thanks, Glenn. Population health.
So population health on the cancer side, we did some outreach in October. And so that helped increase our numbers with the breast and cervical health screenings. We had the mammogram bus here from Logan Health, and then we also did another type of for pink. That what happened is anybody that wanted a mammogram at all within the valley, they could have gone up to Logan Health to be able to get a mammogram. And then there was a group out of the state of Montana that was paying for it, so it wasn't even income eligible. So we were able to get some people in from there. And it was the first time that they did the event, so hopefully we can make it bigger next year to be able to get more people screened for that. Wendy's been busy with her Alive at 25. That's been holding steady. That's that collaboration that we have with Highway Patrol. So anybody under the age of 25 that gets a ticket or has interaction with law enforcement with cars, basically they kind of come in and take another refresher course from law enforcement about just it's kind of like a refresher from driver's ed. You might have forgotten since the time you were 15 to 25. So it's just, it's a pretty good program that they have in law enforcement. Highway Patrol does the class for us, that Wendy organizes it. And then we had some checkup events, and we're trying to make those more often. Wendy's been busy getting people certified in order to check car seats. And so they're trying to make those events monthly to bi-monthly, depending on the need. But we are getting more and more people trained. So Whitefish Fire, Kalispell Fire are all have people trained now to be able to check car seats for the kiddos. So that's been busy there. And then I'll let Lisa update on the communicable disease side.
Good afternoon. So just touching on the lead component. Like Keelan had mentioned, I did the screenings that those agencies do usually every year or twice a year. And so it was kind of a perfect storm because the state just within the last couple months have changed reporting levels for lead. So instead of it being 5 micrograms per deciliter, it's gone down to 3.5. And so that's capturing a lot more people with those lead levels.
Is that on the initial capillary screen or is that on the follow-up?
That is on the initial capillary screening. And then within 12 weeks, they have to have a confirmatory. Whether for kiddos, it can be done on a capillary, but if it's on adults, we do prefer to do the vena puncture. But yeah, they do have to have the follow-up tests to confirm that. But even with the capillary, the initial capillary, we still do an investigation to determine where there might be some lead sources and try to mitigate those exposures.
And this was 7 that's reported here. What's the approximate denominator? Are we talking like
It's over 100.
7 out of 100? I mean, because even 7 out of 100, that's catching a lot of kids. Because I do these in my office, and I hardly ever get a positive. So
Yeah, and granted, the capillary, we do know, I mean, it's a lot more sensitive than a PCR or a vena puncture. So, and I think that's where the confirmation. But yeah, it's we're still reaching out to all those cases to do an assessment and figure out where more the trending sources are. Whether that's, I know we have a big hunting population within our community, and doing some education with parents on reloading bullets, making sure that you're not doing in a basement in a small room with no ventilation when kiddos running around. So
yeah, so I mean, I guess to me, this brings up 2 points. Like if you're catching 7 positives on a screen, the importance of doing these screens on a regular basis, having not done it in the past couple of years, right? So it emphasizes the point, the importance of that we caught potentially 7 of these, number one. And then, the other point I guess thinking about is, thinking about some of those different sources. We don't have a ton of super old houses around here, but I think the ammunition thing is a big one. And then that leads to one last question. Do we do or offer any sort of programs for like rifle clubs or people who where they pack their own ammunition, make their own ammunition, and that sort of thing, that screening for those sorts of opportunities, because that is another potential high exposure group of folks?
Yeah, absolutely. We haven't really dived into that level. We have been talking about doing some more education and putting up, educational stuff within the shooting ranges and places like Snappies and Bellas and things like that. But it's trying to get people's attention.
We do work
Perhaps
with Kalispell. We do work with the police stations though.
So we screen law enforcement for,
Yeah,
for lead exposure?
Certain law enforcement agencies that ask us to do it. Yeah, to
Okay.
do the lead screen for the officers, and then of course, if there's small kids. Training facility and then going back to the household, wearing the same clothing that they wear.
Yeah, no, I just think this is a good reminder of the importance of having an ongoing screening program, that we caught that many in a one-time screening event.
And the fact that they lowered the lead level is even more appreciated. We appreciate that too, because there's absolutely no safe level, but so that's good that we can capture that at that point and not wait until it's 5 and then.
And so weren't there some lead concerns in the water at some elementary schools around here recently that we've been talking about?
Yeah, so the state was kind of taking the lead on that and asking the schools to, if they did flag a source to, if it was a certain level, they would cut off that source of water and then fix that issue. There hasn't really been much in terms of testing because we just don't know how often those sources are being used. So we're kind of still watching that one.
And these were Head Start kiddos, right? That we screened.
Yes.
And the strike test.
Yeah, and yeah, that was outside the school.
So all 7 of these are those children.
Most of them. The other thing that I just wanted to make a mention of is influenza. Well, we're at 12 confirmed cases so far. We're still not at the level yet where we're counting rapid test kits for rapid tests, just because we haven't reached that 10% positivity, but we are getting some reports of some positive rapids out there. So I'm assuming the point to getting to that 10% positivity is going to be pretty soon, just because we know that the trend for influenza activity is going upward. So it's just a matter of time. But right now we're still at 12 PCR confirmed cases that have been reported. Any other questions?
I have one, I'm bouncing backward now to the American Indian Breast and Cervical screening. Are you going to address that?
I can address that.
So, thank you.
Thanks.
The goal is 40, and I noticed last month that it looks like we just launched this, but it doesn't seem to be gaining any traction. Can you explain why we have a separate program?
It's separate out from the state. So it's our outreach that we do down to the Salish Kootenai tribe. So we're working with the tribal people, and it's not just launched, that this is just the numbers for this year. So it's been ongoing for 15, 20 years that we've been going down there to the tribal. But the population, the American Indian Breast and Cervical, it's kind of to capture the individuals that maybe don't access Indian Health Services.
Okay.
And so it's a little bit harder of a population to get to. But we're working with the tribal elders down there, and we're working with the hospital, and just making sure that they know that they can get screened, but it's a harder population to reach. So the numbers, I mean, the goal is 40, but it's, we don't ever quite reach it, but that's not to say that they're not getting screened. It's just within that kind of catch, to try to catch the ones that aren't utilizing IHS.
And that was my question. It seems like, is there a gap in tribal health services that?
Yes.
And that,
Yeah,
that's what we're
and
trying-
yeah, there's just a history with not trusting maybe IHS, so some people don't access those services. And so we're just trying to give them an opportunity to be able to seek screenings elsewhere,
And so the goal number came from
the state.
the state.
Yeah, and if we were to reach 40, they would, and it was to go well beyond, the state would still cover it. That's just a goal.
Okay.
For just that tribe. And that's they don't have to be tribal members to be able to access that. It can be the urban Indian population that we have here in Flathead County, Sanders County, because we're in 5 counties. So
Right.
Lake Lanier, Sanders, Mineral County, and Flathead. So it can be in any one of those, as long as they put that they're tribal, or that they're American Indian.
Right, appreciate that. Thank you.
So next is family planning.
Hi, good afternoon, everyone. So as far as clinical services and family planning, our patient numbers are staying steady. We looked at our new patient numbers, and for the month of October, we had a record high of new patients accessing care. So on average, we see about 30% new patients each month. In the month of October, we were a little over 40%. And we've been trying to chat with patients to see how they're hearing about family planning. A lot of it's word of mouth, but others is some of our advertising and outreach efforts. So we're proud to see that our outreach efforts are working. As far as community presentations, classes, and outreach efforts, we partnered with Flat Valley Community College this past month and did 2 health fairs with them, a women's health fair month and a men's health fair month. And saw a lot of students asking about our services, so trying to reach folks who are at the college who might not be eating the services at the college's clinic, just trying to expand into our community. We also, for the 2nd month in a row for syringe exchange, collected more syringes than we gave out. And we've also really amped up our efforts with our Narcan training. We did 5 Narcan trainings the past month, 1 at the library with library staff. We held our community event. We trained health department staff. We went to Linderman School and trained the teachers there on how to respond to an overdose, as well as staff at the Warming Center. And we have a lot of schools now reaching out to us, asking if we'll train their staff. I think we're going to Evergreen next month and summer school. So really a new service line that we can offer to the community, and we're seeing people really wanting to be trained in how to respond to an overdose. Any questions? All right, thank you so much.
Next is environmental health.
Hello, I'm Jim Wardetsky with Environmental Health, and a couple of things I think that I'd like to highlight are through the accreditation process, we identified, I think, 3 metrics, one of which that we hope to improve on this year is the number of inspections that we are conducting in schools. There's 2 actually separate inspections that occur in our schools. One is the food side, which they've been doing those on a regular basis. The other side is the actual physical facility, things such as furniture, playground equipment, a lot of safety components go into that inspection. And since COVID, the numbers have been very low, some years even 0. And so from my standpoint, I thought, that's a vulnerable population with kiddos and things that could severely impact safety, so that we wanted to focus more on that. So one of the things that we've done with that is to reach out to each of the school districts, find a point of contact, a current point of contact that our sanitarians can reach out to, schedule appointments to do these inspections. And there's a little bit of balance with the scheduling aspect of it, because they like to do them when the kids aren't around. So we're going to try and focus on like spring, Christmas break, holiday break. A lot of times they'll do them during spring break as well. So that's one of the things that coming up here shortly that we're hoping to increase our numbers on. We've also been having conversations and doing some research regarding winter burning, regarding air quality, and we've had an increased number of requests to allow that. And there's a process in place that we need to look into. Apparently, over the years, it hasn't occurred very frequently. So we need to familiarize ourselves with that, make sure that we're following the guidelines that are set forth in the air quality regulations, and see if we can help some folks out with allowing some more. The food and consumer folks, the sanitarians there are approaching their 90% completion for inspections in their realm of our business. And the reason that's important is if we reach those 90% thresholds, there's a reimbursement level that comes back to the county from the state. We reach the 90% threshold, we get 100% reimbursement. Anything below 90%, then we only get that level of reimbursement. So they're very close. They said that the challenge every year is the food smalls inspections, which also include the mobile food trucks and trailers and that. Apparently it's difficult to chase all of those folks down, and that can be a challenge to get to that 90%, but they think they're going to reach it again this year, so that's good news. We're currently, the food and consumer folks are also pursuing FDA Standard 9, which is a risk assessment. And that's in cooperation with a master's student, a practicum student that we have, actually 2 of them that are going to help us with that. And essentially what that does is we utilize the numbers from our inspections to see where there are problematic issues, whether it's hand hygiene or heating and cooling methods and whatever in food service. And then we'll take those numbers, identify which are the top problem areas, and then develop a corrective action plan. And then it addresses 4 different areas within their scope of interest: retail food service, healthcare, schools, and then also delis and butcher shops are the 4. And it's a 5-year cycle. So what we've chose to do, the last time they did this, I think was in 2015. And the feedback that I got from the staff was that it was so labor intensive that it added hours and hours to their already busy schedule. So what we chose to do is split it out into the 4 categories, and each year do one of the categories, and then it'll just continue to cycle itself. And the hope is that as you identify these problems, set forth the corrective action plan, the next time it comes around, when those inspections are done, the numbers will drop, the violations. On the septic and land side of things, in the perpetual effort to improve customer service and efficiency, one of the things that we're looking at doing is doing a couple of mock septic applications. Already talked with the deputy health officer, and she and another staff member are going to act as our prospective applicants. And we're going to have them go through the process. You walk up to the front counter and here's your scenario, and let them walk through, and then they're going to provide us feedback after they go through the whole process to see if they're, able to easily understand it, navigate the process, the website, all of it, and provide that feedback so we can tweak those things and make sure that the services we're providing are adequate. So, and then lastly, one of the things, kind of a proactive effort, is we're looking at our groundwater monitoring policies and procedures. Over the last season, if you will, during the spring, there were some things that came up that could be a little bit problematic that we're hoping to address and fine tune through the application process, through our website, through some of the policies to make it easily understandable for the customer and also the staff. So that way we can reduce the amount of confusion and provide a better product on hand. So that's all I had. If you had any questions. Thank you.
Thanks, James. Next is finance.
Good afternoon. In your finance packet, you've got the numbers for the month of October. Cash balance, just a little over $1 million. That was compared to about 900,000 last year, so we're right in the ballpark of where we should be. The clinic, immunization clinic revenues are up. Again, getting back to normal for the immunization department post-COVID. So good to see. Environmental health revenues are also comparable to last year, so holding in there, even with rising interest rates and so on. Tax revenues are coming in this month, expecting about 650,000 or so for the revenues. Capital improvement wise, the commissioners approved moving a couple vehicles from fiscal year 24 to fiscal year 23 due to some hail damage that we had previously. And that's about it for me. Any questions?
Right, that's good.
You bet.
All right, mosquito.
Afternoon. Well, keeps this up, mosquitoes will be out shortly, so. So usually we try to do this in the past after December, but I'll be out the new baby, so I wanted to get this done before then. And hopefully you each got a copy of it to look at. So it's just a proposed pesticide discharge management plan for the upcoming 2023 year. The changes are pretty simple. You know, number one, amend the footer upon the revision approval. So that's easy. Two, delete Jake Rubo from 1A, 1B, 1C, 1D, and add myself to 1A and Dave Nixon to 1B, 1C, 1D, just to reflect the current personnel in the mosquito program. Number three deals with aerial operations. So as you know, the drone that we used to treat with got shot down. That's under investigation. I've decided as a coordinator to not continue using that drone just due to the financial burden on the program. With more sites, I need more and more people on the ground. And so I can't afford to have the drone and more people at the same time right now. So delete, I'm wanting to delete the first paragraph of aerial operations entirely. The second paragraph, I'd like to keep the Flathead County Mosquito Control District operates a Phantom 4 Pro small UAS only for the purpose of monitoring flooding, examining the condition of our known sites, and locating production sites and areas of mosquito activity. All aircraft are registered with the FAA, and all operations comply with FAA and airspace requirements. That covers that drone. We've had that drone. Bruce Gunderson bought that drone when he was here, so we've had that drone for a while. It is helpful to monitor the flooding and potential sites that we're looking at. So, and then number 4 is just the update the AMC best practices for integrated mosquito management description to reflect the most current version, the 2022 version. And that's it. Any other questions?
Any questions? Thank you.
Yeah.
Are there any areas where the drone used to be able to treat that you won't be able to treat with just on the ground?
There's only one place that I'm going to find a way.
Okay.
but it's the yacht club in Summers.
Yeah.
And as you all know, that's a huge producer, so we're gonna find a way to get that done. Everything else that we treated in the past with that drone, we can treat by foot. That drone replace, we'd have to replace it in 2 years if we were to, continue with it. It would cost the program upwards of 60,000 to replace it. So it's as of right now, it hasn't proven itself to be a necessary tool for the program. Thanks.
Okay, thank you. Health officers report.
So some of the bigger things that we have going on is that we may be receiving money. We have to go through commissioner approval, and I did talk to Commissioner Holmquist a little bit about it, and then I will be reaching out to the other commissioners as well. But the state is going to give us some funding potentially for COVID. What it would be is for administration, so it would cover our admin costs of doing it. So it would kind of offset. It would help the immunization program to offset some of the costs that we've been doing basically for free, hopefully. So that's coming down. I'll just kind of give a little stuff about the shelter. The shelter is overloaded right now. We have a ton of dogs. Again, it's people not being able to get into apartments or houses. And so they're turning in their animals, probably as the weather has changed and people are moving and stuff. And so they've had a lot of owner turn-ins. I think Cliff was saying 4 to 5 a week, which is, and they're not going out as fast as they are coming in, unfortunately. So we did waive the adoption fees and are just charging the $45 licensing fee right now to try to get a handle on it and try to get those dogs some homes for Christmas. So if you guys are anybody interested in a dog, there's some cute ones down there. We have about 40. And then also on the shelter front, where there is a hoarding case, they're not calling it a hoarding case because that kind of, I think quantifies as kind of a law enforcement involved, but it was an individual that reached out to the ACOs that their place was getting overrun. The good news is it wasn't the 300 originally reported, and it's now down to about 100. But they're going to be working with the ACOs are going to be working with the shelter, and they're trying to get we're trying to get our cat numbers down, getting cats adopted, and then maybe trapping about 10, and then adopting them out, and then trapping another 10 to try to help this individual out, so that we can, so they're not so overloaded, so we don't have 300 cats in about a month. So that's the hope. Kehlani and I will be going out to the shelter more regularly. Just the health department hasn't had much of a presence out there as much as we probably should in the past. And so we'll be going to some staff meetings and just trying to get a pulse on it and just kind of get more involved and help them out as much as we can. Just because we just want to stop the staff turnover out there and get them more involved within the health department. So we're going to start doing that this next week. And then we are also currently writing a crisis diversion grant. I say we, apparently it's the royal we. Jeremy is and Kehlani have been working on the crisis diversion grant, and we'll be submitting that. So what that does is it does help support quite a few of our behavioral health projects, but also the co-responder program. So that money does go towards that as well. They are still only with one co-responder at Greater Valley. They've had multiple interviews, just haven't found the right person to help with that co-responder. But Sarah Winfrey has been very busy just as the only co-responder right now. So program is still going well, and we're still waiting for what the reimbursement is from the state. So that's not right now, but and I think that's it. Anybody have any questions?
Because in reality, that correspondent could be like 3 or 4 people.
Absolutely.
Easy.
Easy. Yeah.
Is there, right now, we're just shooting for 2, and then.
Right now, we're shooting for 2 because that's what's budgeted. But if the Medicare Medicaid reimbursement comes back that they are able to sustain more, then I think they'd be willing to. But right now, it's just even finding bodies to, the appropriate bodies to do the job. we all know that it's behavioral health shortage around the country of professionals that work within that field. So it's just trying to find the right person.
They actually released those rates yesterday.
We released the rates yesterday. Are they happy about them?
We have a meeting with Mary
Oh.
tomorrow.
Okay.
All right,
So hopefully they're what Mary would like, so with Greater Valley.
thanks, Jen. Okay, we'll on to committee reports. First one is Environmental Health Committee, and I believe Dawn, you're gonna take that for us today.
So we did have a environmental health committee, and it was concerning a variance we had given to the Appleton Jones variance request. We had approved that. And when they went to get a permit, the environmental health noticed that it wasn't where they got the variance for. They had moved the drain field. Consequently, they came to us and said, well, what do we need to do? What do we have to do? So we met, we talked about it. They had Brett Foley, their engineer, came in and explained that it was just somebody told somebody one thing and then they ended up doing another. And there was actually no test hole dug on that particular site where they wanted to move it to. So what they wanted to know is, can we just go ahead and do it? Because you've already given us the variance. And what we came up with was the variance was for specifically moving this and allowing this in this area. That's exactly what our variance was granted for. So what we said, well, the owner can come forward and request another variance. He can put it where it was originally approved for. And correct, step in here if I get anything wrong. You can go ahead and use the existing variance if he wants to put it in where we approved it. If he wants to move it, he would have to apply for a new variance for that new location. But the question was, well, in order to do that, does he have to rescind his first variance and then ask for another one? If that fails, then he's out of luck. So we went to our county attorney and found out that no, we can leave the first one in place. He can apply for a second one if they so choose. In doing so, if we grant the second one, the first one can be done, essentially. So that was our recommendation, and Mr. Foley will take that back to the owners and see what they want to do. So that was what we wanted. It was all unanimous. I think we're all happy with that. And the question was, could we leave the first variance in place until we got a second one, if so wished. So that's where it went. Anybody have any questions on what we were looking at there? Okay, great, thanks.
Does anybody from Environmental Health Committee want to speak at all to the concerns from the public comment? Or does anybody have anything to say about public comment that was shared? No, probably the appropriate time if we have any
About our
response to that.
spot for the septic.
Yeah.
Right, I
Does
can
anybody
speak
have-
to that.
Yeah, does anybody have any response about that?
Yeah.
Sure.
And
And we do have a portal, as you've been over to the commissioners, and we do have a portal up on our website with some Q&A stuff. And of course, we have our phone numbers are available for any other questions. I think we gave most people everything they needed for information. And if you have other things you need, please go to Pete or, and he can help you with me. Yeah, it's basically right now.
Not me.
Yeah, basically right now, there's a buy-sell that was put out there for a piece of property that's like next to Lakeside Water Sewer holding ponds. And it's really in the infinite stages right now of, there's just a lot of things to happen. First of all, there has to be an appraisal of the property. There's some testing being done. HDR is working on some rates, some, the amount of sewage that we're projecting, just a lot of projections, a lot of stuff we're just working through. There's also going to be two public hearings on December 1st. In the Kalispell Commissioners Chambers one at 10 and one at 6. So if anybody's interested in coming to those, you can come to those, just a kind of a question and answer for the public to come in and ask questions of HDR. They'll be leading the meeting, they'll be answering the questions and just kind of giving everybody what's going on. So that's what's in place right now. And until we get some of the other stuff, other data, that's kind of where we're at. So, yeah. Sure.
I forgot to
Come on up to the,
It has also recently come to my attention that there is no environmental impact statement required for this project, and that concerns me greatly.
you know, that's a question for HDR.
I will
don't know
ask
what's
it. I was
required.
planning on asking on the first as well. But
Yeah, yeah. So, yeah, definitely, you know, bring up that. I think what I heard, there was a MIPA, but I don't know that, just what that is. So HDR can answer this question.
Thank you.
Yeah, you bet.
I'd like to add something to that,
Yes,
just
yes.
for information, we started off looking with HDR, looking at a piece of property actually, the north side of the highway. And that was the Big Fork already had all the easements and they own a whole bunch of property. Initially thought that would be perfect, Big Fork declined. So then HDR went out and started looking for another piece of property for us. So this is where we're at. So I guess we're still, nothing's been set in stone yet. One thing that I asked Commissioner Holmquist was, has the money that we've been approved for this project, is it still safe, even though we're putting this off for a longer time and more testing? And Commissioner Holmquist told me, yes, as long as we have a plan in place, until we're working toward the project, our money is safe for moving this. Now, obviously, though, we need to get it done fairly soon, because trust me, there is the Folk Holland septic now, with all the growth and everything, they don't have anywhere to dump it. And growth is two ways. It's adding more septic. You have to get your tanks full. It's taking away areas to be able to dump it. So this is it's a very high priority, but I think between the board and the commissioners, that the right decision will be made and all these concerns will be addressed.
there was another thing. Oh, sorry to keep adding, but I also heard that several years ago, there had been a site near the landfill, and we actually, looking at the map, had thought closer to there might be better suited. And I had heard that a county commissioner voted against it and it got squashed because it was in
That's not true.
their neighborhood.
That's not true. What happened, what I understand happened up there is the landfill couldn't maintain the water, the amount of water that it would produce. They just couldn't take it. They could take the solids to a point, but they're also running out of room for solids because all the cities haul their solids to the landfill and they can only put so much in. And they were running out of room for that. And then the water was an issue.
Sure.
And that's why we're looking to other districts to possibly take the water, because the water's, there's a lot of it.
So what happens if Lakeside Summers, because they're expanding, they're growing as well? I know the area that you guys, that you were hoping to use those properties that Lakeside Sewer District.
Right.
Out of the pivots. But
Well,
what
they're
happens-
expanding
They
right
are
now.
again-
Yeah, they're in the process right now of expanding. They've already started that process, I don't know, several months ago. And we asked them that question, well, can you take us, right? And one of the reasons we chose that area is because they said, yes, we want you for a customer. Yes, we have the capacity. Yes, please come to us.
Okay,
So,
yeah, even if they had a little, because it's only 22 usable acres on that property that's being purchased. I don't know, I think that there's gotta be 22 acres that are right next to where people live and children ride their bikes and.
Well, it's all under investigation.
Okay, well, I
Yeah.
will keep praying.
Yeah. But thank you for your comments. Anybody else? Yes, sir.
I would like to add to that too.
Yes.
I sit here as a representative of the city of Kalispell. And the city of Kalispell is also, although we have a great state-of-the-art sewer facility, we have to deal with solids. And if Glacier Gold closes in there, that is probably inevitable at some point, we still have to have a place, yeah, as a city, as a municipality, to deal with this. So it does affect the municipalities, and we need to be forward-looking as well. I spoke to the mayor about this exact issue, and we definitely want to see the county move forward with this and be involved any way we can. But we were investigating it as a city, a municipality, what could we do, separate even from the county? And we've done a lot of investigation in all these different fields, and from incinerating to composting ourselves, et cetera. And actually went and viewed different facilities. And the first thing I will tell you is, number one, the engineering has to support it. You know, all the things have to be in line or it's not gonna happen. Water quality is gonna be looked at, et cetera. So I trust the county's gonna do their job, engineering firms do their job. So health-wise, it's gonna be a long-term sustainable thing if it's approved. And the other thing is, all the things that we hear and fear about, oh, you know, sewage facility close to my thing. When you actually go out and look at some of the facilities, you wouldn't know it's not some industrial farms, I've been through pig farms that are worse, you know, in Iowa and that sort of thing. So if it does get passed, if everything meets muster, I just think that, you know, it has to be done, it's gonna go somewhere. But I understand what it's like to say, gosh, it's right across the street. But
It's not across the street, it's across my fence line.
I understand. And we dealt with this, you know, at a municipal level all the time when we're annexing county property, rezoning and that sort of thing. Everybody is part of a larger picture, part of the community, and there's no easy answer, but it's usually not as bad as we think.
Okay. Anybody else? Okay. Great. Okay, we'll move on to Personnel Committee. I'll take that. We met just before this meeting to consider Jennifer Renkowski for the Health Director position. We had discussion amongst the board members and ultimately voted to move a positive consideration forward to the health board to make a decision on their end. And the way the process works right now is the health board you all hopefully had a chance to look at the resume and consider it. And the way the process works is the health board now will make a recommendation to the commissioners, what they're feeling. So I guess I'm going to open it up to discussion first before we go to a vote, or whatever the board's pleasure is. So this would be a contract to hire Jennifer Renkowski as our health director position.
Should we have had an action item on the agenda? for this?
No, it's part of the personnel, we're fine.
Okay.
So I'll make a motion to forward our recommendation to the Board of Commissioners for approval of the hiring of Jennifer Renkowski as our board health director.
Okay. Second, okay. Any discussion?
I'll throw some discussion in after that this is what, by going through a little bit I've been involved in trying to hire someone. It was hard. I know you other folks have gone through a lot. And as soon as Jen said that she would step up and do this on a part-time basis, I'm like, oh boy, because she's got all the experience, she's got all the credentials, and the wish to do it, well with all the groups she has to oversee. So I think we were excited as a group, as personnel committee, to see her come up and say she would like to have that job. So
Any other discussion?
I would just like to say again, and I made this comment after prior interviews with people that I didn't think were suitable for the job. I always prefer to hire from within, to promote from within. It always makes for a stronger organization. In the business world, there are tons of studies out there that prove it out, and I look forward to for you.
All right, any other discussion? All in favor of the motion? Or let's take a roll call.
Artist,
Yes.
Don,
Yes.
Jessica,
Yes.
Pam,
Abstain.
Pete,
Yes.
Rod,
Yes.
and Ronald.
Ronald, are you still with us? Would you like to say anything? It's quite a
Thank you,
step.
guys. Thank you guys for trusting me with this and, talking with everybody that I work with, and we just thought it would be easier for us just because we've been through a lot the last, but this would be the fourth health officer in the last 2 years, and it just adds a little bit of continuity for everybody and just kind of stability for the whole staff. And we have an amazing staff right now, and we just want to get back to doing the work that we had done before, and just kind of put everything else away and just move forward. So I think it was just the best case scenario for everybody involved, and just didn't want to have another change for the staff again. So thank you.
All right, board member discussion. Artis?
I don't have any.
I don't have anything.
We're gonna have a December meeting.
I don't believe so, because it falls pretty darn close to Christmas. And
We'll take
if there was a variance that comes forward, I've talked to Jim that we would try to have maybe an online board meeting if we needed to view a variance or something like that, so we don't have to put somebody off until January. But other than that,
The third Thursday is only 15.
well, I think in the past, we haven't done it around the holidays because it's hard to get people in here for that. But if something does come up, we can always have an online one or have a quick one.
Yeah, normally we take December off.
Yeah, normally we have, yeah. It's just been since you've been on the board
Yeah,
that we
just-
haven't.
We haven't any time off.
I would say congratulations to the health department for all the hard work that you've done and the reaccreditation. So good
Oh, yeah, I forgot to
job.
mention that.
You guys worked so hard on that, so thank you.
Don't tell Malia I forgot. Yes, we were reaccredited
You did
and
great.
we were very proud of that. And Malia truly was the driving force behind it to make it happen. Because she just kept us all in line and made sure that we did everything. And it's been great because we have new processes in place and how to do things. Jim's kind of a prime example is he's just trying to clean things up in environmental health to make sure things are done in a, concise manner so that we're not having to clean up messes later. And that all has to do with accreditation and just holding us to the level that we need to do. So yeah, it was a great accomplishment for everybody.
Sure.
I would second that. I'm
Yeah,
sorry,
yeah.
I forgot that. I read that. I was impressed when I read it on the email, and yeah, congratulations to all you guys for showing that how good you really are to keep that accreditation. So I'm very proud of you
It's a big deal.
guys. Yeah.
5 more years.
Okay, Pete?
Good.
Okay. Well, wish everybody happy Thanksgiving, and we are adjourned.
I make a motion to adjourn.
Oh, we are. Second. All right, now we're adjourned.